I believe Mr. Bourgeois is on the phone.
We will put him on the air here. Good morning, you're on KSJE. Thanks for calling in this morning.
Hey, Scott. Good morning. Jeff Bourgeois. How are you?
I am good, Mr. Bourgeois. Thank you for calling in from San Juan Regional Medical Center, of course, and we appreciate it because I'm afraid we know just how busy your folks are over there with the numbers that we have been reporting. And so what can you tell us on this Monday morning?
Well, much like last week, Scott, it's just continues to be very busy both here and elsewhere in the state. I think we know there are, there's 845 hospitalizations currently statewide. That's up from 825 from yesterday. And currently at our hospital, we have 52 patients on our respiratory floor. 48 of those have a confirmed COVID-19 positive test result. We're a little lighter today in our ICU than we were going into the weekend. So we have 10 of 14 beds full in our COVID ICU and 5 of 9 beds in our non-COVID ICU filled between the two. So between those 15 patients, there's a total of 8 ventilated patients. Very busy. I think probably for us, what is really different than the first wave is that during the second wave, hospitals across the state are much busier than they were during the first wave. So the ICU capacity where we would typically transfer patients to is tight, and so we have daily calls even across the weekend to just measure our ICU capacity and see if we have a need to move an ICU patient where we might have the best opportunity to do so. And I will say that the hospitals in Albuquerque and Santa Fe specifically have been a wonderful resource to us, as on any given time we can. So far, we've been able to find a bed or two and move patients. So great coordination amongst the hospitals statewide, and just really watching all the numbers as everyone else is. But we do not yet know when the second wave will peak and turn softer. We are concerned about the holiday season coming up, and with a lot of travel and large gatherings, it is not unrealistic to expect some increases in cases and subsequent hospitalizations after these major holiday travel and family gatherings that typically take place. So we just encourage your audience, Scott, to just use extreme caution around travel and the size of gatherings and the length of any gathering that you might have. Community spread is the primary source of COVID-19 spread, and anything we can do to help reduce that spread is sorely needed at this time.
Very good. Good morning, Jeff. I have a question regarding the ICU changes, some of the decreases. Is that because of mortality or is that because of recovery?
Hi, Megan.
Hi.
It's what we've noticed is the number of deaths this time around relative to our hospitalization is down, and the county tracks that well on a week-by-week basis, and so we're nowhere near where we were back in May when we had a couple of weeks where we had 19 deaths here in San Juan County, not just at the hospital, but at San Juan County. And, the numbers so far, the second wave, have been less than 5 per week. Now, that could certainly change. I think caregivers, physicians, and clinicians have learned a lot from treating the disease this go around, and we're seeing the benefit of that. So mostly for us, it was our ability to transfer out or downgrade patients from ICU to a lower level of care.
Very good. And I know, of course, we've been saying since this began that hospital capacity has been one of the biggest concerns. In the beginning of this thing, the National Guard had come in, started setting up field hospitals up near the airport. Are field hospitals still in the works? Has that already happened?
That's a great question, Megan, and there's a lot of confusion around that. Previously, the National Guard resources that we received here were not really for hospital level of care. They were for patients that had a COVID-19 diagnosis, weren't really sick enough to stay in the hospital, but didn't have a place to go, or they needed to quarantine to protect their household. And so it was it's called an alternate care facility, an ACF. We don't have one planned with the National Guard to date. I do understand that last week in Albuquerque, the old Loveless facility on Gibson was being stood up to be able to handle a total load of about 20 individuals, again, for some very light oxygen therapy and quarantining while they were not sick enough to be in the hospital.
Understood. Thank you, Jeff. And I wanted to ask you, too, you mentioned being able to transport out some patients to Albuquerque. So obviously there's still some capacity there. Are we in danger of maxing out their hospital capacity and they're no longer able to accept patients from your facility, or is that still a little bit of wiggle room there to kind of help with the patient loads here?
There's still wiggle room today, Scott, but if we start pushing up towards 1,000 hospitalizations, another 150 or so, I don't know what it'll look like, to be honest with you. Suzanne Smith, our chief nursing officer, and myself, we have twice weekly calls with the regional hub, the other 7 hospitals, plus representatives from the state, where we kind of monitor that. And then Suzanne is on a daily call. So we monitor that, but that's kind of a worst case scenario risk that everyone is trying to avoid. So most hospitals are taking steps to reduce elective procedures that would require an overnight stay in order to preserve that bed for an emergent admission or a COVID-19 admission, just to help meter the inpatient census statewide. And we've done the same thing here. We're still conducting outpatient elective surgeries. We're still doing all essential surgeries, whether they be inpatient or outpatient. And the surgeon, along with our anesthesia team, look at that on a case-by-case basis and make sure that we have the capacity here at our hospital to take any surgical case that will look like it would need an overnight admission. They're doing a great job with that. So the hospitals are self-managing their capacity as it is right now.
Very good. And I have a question about the COVID to Home program. Has that been really effective in preventing sort of the revolving door that might happen with hospitalizations?
It really has, Megan. I don't have our current census numbers on that program, but it's quite a bit. And what has really helped us is to keep people at home and monitor their vital signs, including their O2 sats. And if they have a mild enough case, we just have an advanced practice provider checking in with them on a regularly scheduled basis, and to number one, help provide comfort and insight to the patient as their course of illness progresses, and then secondly, also catch patients who are getting worse, and with that vital sign and O2 sat monitoring, we can understand if it's time for them to come to the hospital. And we've had a number of great catches that way. So thanks to our team that is doing that work. They're doing a great job there.
Very good. And I wanted to ask a bit more about staff too, Jeff Bourgeois, because we hear some hospitals across the country are seeing this increase in patients, and while we can increase beds and we can open up a field hospital if we need to or what have you, we can't increase the number of trained healthcare professionals that are working in our hospitals. How's your staffing? And I guess the other question is, how is your staff doing? Are they working long hours? I mean, I think just we need to be made aware of just what's going on there at the hospital, and how the staff is stepping up and has been stepping up for months now.
They have been, and that's a great question, Scott. We have agency staff coming in, which are temporary traveler positions that came in last week. We're onboarding more this week and next week, and we are developing incentives to help our staff if we need them to work extra shifts for us. It's a real balancing act. We need to get people off the front line so they can get some rest. This is physically and emotionally challenging work. When you have the level of PPE you have to wear and the intensity of care provided to patients, both on the floor and in the ICUs. So we want to give them a chance to get away and decompress as they can, but we have developed a program that we're rolling out this week to help them if we need to ask them to work an extra shift. And we're in the same circumstances so many hospitals are. Those calls that I mentioned to you, that we have the regular check-ins with other hospitals across the state. It's these higher than average patient loads across the state, and the higher than average critical care patient loads across the state really do put a strain on the system, not only in terms of physical capacity, but as you mentioned, just having the professionals, nurses, respiratory therapists, and other having enough of them to meet the patient care demands.
Absolutely. I'm happy to hear about that program. And thank you, Jeff Bourgeois, to coming on again. I know you always give us your time. Words are apparently very difficult for me right now. But we so appreciate San Juan Regional Medical Center. We so appreciate all of you guys giving of your time to inform the community.
Thank you. Yes, Jeff.
Thank you, Megan and Scott. Appreciate you all as well. Have a great day.